mean by that? So if you see, there are very well documented studies, there are very strong statistical analysis that kind of puts forward that patient education, they reduce healthcare burdens in the long term, reduce cost, and increase the quality of life. But frankly, in our opinion, in the past 40, 50 years, we don't think a lot of, utmost focus has been paid to patient education, and that's what we are trying to build up out here. What does patient education means? The first part is the informational and the emotional support that a patient requires. Healthcare journey for a patient can be very alone. It's very, very overwhelming. People become anxious, they become scared, and we need to take them out of that emotions. So that's the first part. Second is who can actually educate them, right? There's a lot of content which is flowing around, but the essence is, and we all go to schools, whenever a content is actually taught by a teacher, you also get the content, you also get a lot of confidence in your life. And that is why the entire philosophy behind DocTube was that the best educators are doctors. And can we create something, where they communicate directly with patients, talk about the emerging healthcare stuff, talk about chronic healthcare conditions, and give them a lot of confidence. And that's essentially what we have done. That's why we say DocTube is by doctors for people. And it is really a pleasure for me to thank all the doctors, in India, of course, globally, right? I think they do a lot for their patients. The second part was, it was very, very critical for us to also see that there's a lot of misinformation that is going on in healthcare across, and I think it was very important for us to talk about the authenticity of the data, and that's why DocTube only has verified information, which means only doctors who are verified can actually put healthcare education stuff on DocTube. Today, as we are launching, and I'm very pleased to say, DocTube already houses more than 10,000 videos by 3,000 plus doctors, and it handles around 1,000 medical, I would say, conditions at this stage. 80% of this is in vernacular language, and that is a very, very critical part of what we do, because we believe that in a country like India, the vast linguistic needs really dictate for us to communicate in those languages which people understand. The target is by next year we will get to 50,000 videos, and we'll make sure that anything that a general person needs in India. He can be anywhere. He can be in Arunachal Pradesh, he can be in Jammu and Kashmir, he can be in Maharashtra. They should be able to get that. So that's what DocTube is, and I'm really happy that I am with Sir, and Sir is, of course, everyone knows that Sir is a very renowned cardiac surgeon, and of course the list of the surgical feats which Sir have done is well documented, and I'm no one to comment on that. But I'll go to the other side, and I was talking to Sir before the session, that my first impression of Sir was in 1990 when I was 8 years old. In fact, so Sir actually operated on my Tauji in 1990 in BM Birla Hospital in Kolkata. And it was an open heart surgery. It was not like today. Open heart was a major surgery in 1990. And I still remember, I was too small to go to the hospital, but my eldest brother, who actually went and he came back, he said that, I met Dr. Shetty, and it looked like it's a very simple operation. That's the kind of thing which he got, when Sir explained to, him. And that's exactly what we are talking about here. And Sir, we are going to ensure that we follow your footsteps in terms of getting the patient comfortable in what he's doing out there. I don't know, a lot of you might be also knowing that Narayana group of hospitals, they do more than 10% of cardiac surgeries in India, or even more than that. And the model is just amazing, affordable. It goes to like every person in India. And I think that is what India needs today. Sir's unwavering humility, I should say, and the first time when I came to invite him, I was very scared. I said what I'm going to talk to him, but I think his humility put me at ease. His strong drive to make sure that healthcare is accessible to everyone, irrespective of economic status. That is the main drive which we got from him, which we are going to do. Again, the list of awards I'm not going to count. Padma Shri, Padma Bhushan, Dr. B.C. Roy Award, Karnataka Rajyotsava Award. Like I can go on and on. But sir, it is truly my pleasure to be with you today. And we could not have asked for anyone else except you, sir, to launch DocTube today. So, sir, with your permission, we would like to dedicate DocTube to the people of India and to all the countless medical staff, to all the countless doctors who over the years have worked to better patient outcomes amidst minimal resources in India. So thank you for all the service. And sir, today's topic that you're going to talk about, which is dissociating affluence from healthcare, it's such an important topic for all of us in India. We would really like to hear your views, sir, out here. And as young entrepreneurs, sir, how can we help in that vision? That would be also very helpful, sir, and we'll try our best. Again, sir, please. Thank you very much.
Thank you. Thank you so much. Saurabh, first of all, I would like to congratulate you for this great endeavor of launching DocTube, which is extremely important for a country like India, which has huge billions of population, and they desperately need information about healthcare. Thank you so much for giving me the opportunity to talk. Thank you. The topic I would like to discuss today is my assumption that within 5 years, India will become the first country in the world to dissociate healthcare from affluence. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens can enjoy. Why I am so confident it's going to happen? I just want you to analyze the data. We produce over 1 lakh doctors every year. We produce the largest number of nurses in the world. We produce the largest number of medical technicians in the world. We are the pharmacy for the world. We have outstanding doctors across the world practicing in US or Europe. Good number of them carry an Indian surname. We are privileged to be living in a country which has all this strong so-called foundation of healthcare. Our problem today, our only missing link, is that people do not have the money to pay for the healthcare. I know there are a large number of various government schemes are trying their best, but we must remember we are 1.3, 1.4 billion people. It's a large number of people. So what will happen in the future is the development, primarily because of the government initiative in opening up the health insurance sector for wider participation by large number of entrepreneurs who want to disrupt the health insurance arena. How that will happen? I'll give you one example from my little experience. A typical patient of mine is a young lady with a little baby on her lap coming from Eastern India. The baby has a hole in the heart. I examine the kid and I tell her that she requires operation. She has only one question after the pronouncement that the child requires operation: how much it is going to cost. If I tell her that it's going to cost 2 lakh or 3 lakh rupees, which she doesn't have, she starts crying. She asks for the help. But at the end of all that, when she is about to leave my office, she would turn around and say, "Ami 1 lakh dete pari. I can give you 1 lakh rupees to save my child's life." that made me to think, if only there is a health insurance for her family with a premium of say 10,000 rupees per year, which is a fairly large amount of money. This lady has enough money to pay the health insurance premium for the next 12 years. But what is missing? I don't have a health insurance. This is what we don't have. Is it that difficult to build a health insurance? It is not difficult. I believe that there will be large number of health insurance companies coming up with all these affordable health insurance schemes, which will pay for all these catastrophic illnesses. It may even cover the primary care, secondary care, tertiary care. It is a matter of time before it will happen. How many of us dreamt that with your mobile phone, you can pay anyone you want, wherever you are, and India emerging as the largest country in the world for the largest number of UPI or the payment transaction. We have beaten China, we have beaten US, we have beaten all the countries. And all this happened in 2 years, 3 years. So we are an amazing country. We have changed many, many things. You look at mobile communication. Today, mobile communication is truly democratized. Whether you are a rich man or a poor man, you have the same bandwidth, you have the same tower giving you all your communication tools. There is no difference between a rich man and a poor man. Look at the entertainment. Whatever the rich man has access to all these various TV channels, even a man living in a slum also has access. We have democratized everything. It is a matter of time. India will democratize healthcare, and that will happen in the near future. And when this happens, there will be many changes happening in the lives of the doctors and the people who are involved in the healthcare. First thing is, digitization will drive the healthcare, make it safer for the patient, make it accessible, makes it affordable. More than 70% of the first time consultation with the medical specialist will happen online. It's a matter of time. Patients will choose to visit the hospital only if they need some procedures. That will dramatically bridge the gap of distance. It doesn't matter where the patient is. What is the distance between the patient and the doctor? They will be able to consult whoever they want to, whichever doctor they want to consult, whichever city the patient lives. That will be a big game changer. Other important change, what will happen inside the hospital, is almost all the hospitals in a matter of time will become paperless. All the data of the patient will flow with a seamless communication between the patient, doctors, nurses, technicians, and the medical equipments. And it's a matter of time before, it doesn't matter whether the patient is in the hospital or at home, they can be monitored wherever they are. All this transformation has happened in every industry, and healthcare has always been an exception. But India will break the barrier in creating all those tools to give a digital experience to the patient and the family. So healthcare of tomorrow is going to be dramatically different than what it is today. This is the new India, and we are privileged to be born in this great country. Thank you once again for the opportunity.
Thank you very much, sir, for your kind words, and we have taken all your words by heart. So we will do our best to work on the mission that you have seen for so long, that you have worked tirelessly in your entire life. That's the commitment that we can give you. I do believe, sir, because I've been doing this for the past 7 years now, we have seen a huge change post-COVID in terms of the attitude of both doctors and patients to adopt digital technologies. And I think that is something which is going to bring a new world for us. there's a lot of work that is happening in AI in healthcare, which is going to help doctors out there to provide more accessible, affordable, and equitable care to patients. And so we will work on that side and support you. Thank you so much, sir, for your time. And we are really privileged and honored. And Shalini,
We're truly honored to have Dr. Shetty's wisdom and expertise as we embark on this journey with DocTube. His remarkable contributions to the healthcare industry and his commitment to improving patient health outcomes are truly commendable. We extend our heartfelt appreciation to Dr. Devi Shetty for taking his time out and sharing his valuable insights and inspiring us all with his vision for a more inclusive healthcare system. Last but not the least, on behalf of the entire DocTube team, I would like to extend my gratitude to each and every one of you, our participants and viewers, for your presence and engagement throughout the session. Your enthusiasm and interest in DocTube have truly made this a memorable occasion. Together, let us revolutionize healthcare and create a brighter, healthier future. Thank you and have a wonderful day, everybody.
Thank you.